All right, next up in our Pharm course is a quick one. We're just going to talk about some characteristics of medications and then kind of explain what these mean. You're going to be digging into the med cards here before long, so we wanted you to understand what they mean. Everybody needs to know this. This is the second in the terminology unit. We're just about done. And after we confused you and did some tongue twisters with the autonomic stuff, this stuff is straightforward. So when we describe medications, we're going to talk about their action, indications, contraindications, side effects, that sort of thing. Action. What is the definition of an action of a medication? And it's very simple. It's what it does to the body. Period. That's it. What is the action of a medication? It's what it does to the body. Examples of that might be that a medication its action is that it's a positive chronotrope, which you now know means that it increases the heart rate. The action of a medication could be that it's a parasympathetic antagonist or an anticholinergic. Same thing. What would its net effect be? Well, you remember back now that's positive chronotrope. So the action is what it does to the body. The indication, however, is why you would use it. So if a medication is something that vasodilates, that's its action, it's a vasodilator, why would you use it? What's its indication? To reduce preload. Let's say that a medication's action is that it's a parasympathetic antagonist. It takes off the brakes. Why would you use that? When you needed positive chronotropy. That's its action, positive chronotropy. And in what cases would you need positive chronotropy? A patient with symptoms from a slow heart rate. Kind of making sense? What is the action of morphine? Well, morphine, its action is that it is an analgesic. It reduces pain. When would you need that? What would the indication be? Well, when you have a patient that needs pain control. So that's pretty simple and straightforward. And so now you've got contraindications. Well, if an indication is a case when you would use the medicine, then a contraindication would be when you would not use the medicine. Now, from your EMT life, you've heard of contraindications, perhaps a nitroglycerin, definitely to a king airway or a combi tube. A supraglottic airway would be contraindicated where there's esophageal damage. So a contraindication applies to techniques, equipment, and medications. It's a treatment. So a contraindication to the treatment would be when you would not use it. For instance, the 4 contraindications that we teach for nitroglycerin are listed here. You would not use nitroglycerin when the patient's already hypotensive. You would not use nitroglycerin when the patient is having a right ventricular MI. You're not even sure how to figure that out yet. That's fine. By the end of the course, you will know how to figure that out, and you will realize why nitroglycerin is contraindicated. You would not use nitroglycerin when the patient has recently used his erectile dysfunction meds. It says so on the commercial. And you would not use nitroglycerin when the patient's bradycardic or has an AV block, which you're not even sure what that is yet. That's fine. There are 4 contraindications to nitroglycerin, and you will start to learn them. But before you can start to memorize and flashcard and learn contraindications to specific medications, we want you to at least understand what a contraindication is. It's a situation where you would not use the medication. Moving on, side effects. Side effects are things that we're not surprised when the medication causes them, but they're not the intended actions. So that sounds like a little bit of double talk, but let's try this. A very common side effect of morphine is nausea. I would never give my patient something to cause nausea, but I honestly can't remember giving morphine in the field to a patient who didn't get nauseated. So it's a side effect. It's expected, but not intended. Nitroglycerin causes my patient to have a headache. I don't give anybody something to cause a headache, but I'm not shocked and freaked out and think the patient's having an allergic reaction when he gets a headache to nitro, because lots of people get headache to nitro. Patients, when they take albuterol, whether it's by their MDI, their little puffer they carry with them, or it's a nebulizer that we give them, they get a little bit of tremor, they get a little shaky. Their heart rate goes up a little bit sometimes. I'm not shocked by that. I expect that to happen. I certainly did not give them the albuterol because it's a positive chronotrope. Cool how I snuck that term in, huh? I didn't give it to them in order to increase their heart rate, but it's a side effect that I expect, not the least bit shocked by it. Okay, when we talk about dose, we're going to talk about the amount that you give, the rate at which you give that, the route that you give it through, and then when you can repeat it. So again, as you look at your med cards, you're going to see indication, contraindication, action, side effects, and then there's dosing information. Now that first one, 0.25 milligrams per kilogram over 2 minutes, that is the dosing information for cardizem, for diltiazem. The bottom line, 0.5 milligrams IV push repeated Q 3 minutes up to 3 milligrams, Q meaning every. I didn't make this up, I'm just teaching it. So 0.5 milligrams IV push, you can repeat that every 3 minutes until you've given a max of 3 milligrams. That's the dosing information for atropine. So when somebody asks you, hey, what's the dose of atropine? It's that whole answer there. It's not 0.5. That's not the right answer. That's not specific enough, and it's not complete. 0.5 milligrams IV push, repeated Q3 minutes up to 3 milligrams. We'll practice this over and over so that you start speaking in these sorts of terms. Adenosine, what's the dose for adenosine? 6 milligrams rapid IV push through a proximal vein followed immediately by a flush, repeated 1 time at 12 milligrams. There you go. There's the dosing information. So I just wanted to kind of set the stage for the med cards and give you an idea of some of the stuff that you need to know and why you need to know it. Then the other thing we add in here is how it's supplied. Now this varies all the time. And having worked for hospital-based services for a lot of my career, it seems like that as soon as we got used to the way a medicine was coming to us, the way it was usually packaged, and we found a good place for it in the med pack, then the pharmacy would find a better place to get it or a cheaper place to get it or something, and it would change. So change is normal in lots of things in life and in EMS, and it's definitely that way with medications. These days, there's medication shortages, and so different packaging comes to you. So you have to really be kind of heads up, and this is one good thing to do during truck checks. Don't just see if there is magnesium sulfate in the bag. Check on the packaging, see if it's what you're used to, and then go over in your mind action, indication, contraindication. It's training. Truck checks are training. And so you should check your med bag because they're your meds and it's your license and your you-know-what that's on the line. And so you can do these sorts of things. You can review med cards as you're checking. And just, if you see something packaged a different way than normal, think about that. But we like to give you how it's usually supplied. A lot of these things come in preloaded syringes. Some come in multi-dose vials. We'll talk about all these later in the packaging section. I just wanted to give you let you know that the how supplied line on the med card is there for a reason, and we try to give you examples of common packaging.